Cancer can't live in an alkaline environment. That's what you hear a lot, but it's actually not true. However, there might be something to it, which we'll talk about now. Hey, I'm Gene Wei from Anti-Cancer 360, where we help people integrate natural methods with their oncology treatments properly. So take a look at this study here. Researchers at USF in Florida wanted to see what would happen if you used baking soda to alkalize mice who had cancer. Because as you can see here, tumors are often highly acidic because they have to metabolize a lot of sugar. And this lactic acid can support cancer processes in many ways. But they showed that if you added baking soda to the drinking water for the mice, it could actually reverse the tumor acidosis, as you can see here. Now, this baking soda didn't make the blood of these mice more alkaline than it should be, but it did normalize the pH of the tumor tissues back to the same pH as the rest of the body, as you can see here. But take a look at this here, because the baking soda did not shrink the primary tumors. However, it did lead to less metastasis. And as you can see here, they think that the baking soda makes it harder for the cancer cells to catch in other areas of the body once it leaves the main tumor site. But again, the main tumor still grew, which is why I say that cancers can live in an alkaline environment, but maybe they just don't thrive as well. It's important to note that this is an animal study, so what happens in animals doesn't necessarily translate to humans. And remember that this isn't medical advice, and you should definitely talk to your doctor before adding anything to your program. However, there is something that probably would be compatible for basically every case. That would be something like Gerolsteiner water, as you see here. Because this type of water, as well as some other brands out there, are highly rich in bicarbonate baking soda naturally from the source. So whether or not drinking this type of water would be enough to neutralize the acid for your case, depending on your tumor load, it's probably safe for most people, so you could definitely consider it. So now you know the full story when someone says,